Alright, welcome everybody. We're going to start off by talking about antibody-disease correlations. Now, this is going to be a lot of memorization because I'm going to tell you an antibody, there's going to be a certain disease associated with it. Why do we see all this? It's due to the big word autoimmunity. This is simply where we have immune reaction against our own tissue. So we're going to have antibodies specifically produced against our own tissue. Our tissues are going to express antigen, whether it be the nucleus part of a cell, whether it be an enzyme part of the cell, whatever it may be. We're going to have an antibody produced against some part of that cell. Now, whenever you see a certain type of antibody, there are going to be certain diseases that are going to be associated with it. And this is going to be due to immunity. So autoimmune diseases will have expression of certain antibodies. Now, not every antibody is specific or sensitive. They're not all specific and sensitive. Some diseases may overlap. That's going to be an important factor. However, if you see this antibody, you need to at least start clinically cluing in. So why am I going to cover this all today? It is going to be a lot of memorization. However, this is simply to get you test points, to get you board points. So memorize this stuff. You know, it might not be the most fun to memorize. However, this stuff is really important. And we're going to start off with probably the most important antibody, at least in my opinion. So it's going to be anti-nuclear antibody. It's going to be shorthand for ANA. ANA is going to be how you see it most of the time. Anti-nuclear antibody. Now, what disease is going to be associated with this? SLE, systemic lupus erythematosus. This is going to be a big one. If I had to memorize one out of any of these, it would be ANA. Now, ANA, like I said, it's not the most specific. It's pretty sensitive for SLE, but it's not the most specific. Now, we've also got these other antibodies. If you see anti-double-stranded DNA, I also want you to think about SLE. If I see anti-Smith antibodies, I'm going to be thinking SLE. See how this is kind of how I said not every antibody is specific and sensitive. You may see multiple antibodies. So if you are suspecting lupus, systemic lupus erythematosus, I want you to be doing kind of a mental checklist in your mind. Well, do we see anti-double-stranded DNA? If we don't see it, it doesn't mean we don't have SLE. However, if we don't have ANA positive, if we're not anti-DS, double-stranded DNA positive, if we're not anti-Smith positive, you know it's probably not going to be SLE. If I see anti-rheumatoid factor, now this is also going to be seen as anti-IgG antibody. So it's also going to be seen as. Now, I do need to warn you that there are going to be quite a few also seen as. So anti-rheumatoid factor is also going to be known as anti-IgG antibody. What is this going to be specific for? Well, hopefully you can read rheumatoid. So it's going to be rheumatoid arthritis. Okay, so when you see anti-IgG, anti-rheumatoid factor, I want you to at least start correlating it to rheumatoid arthritis. It might not mean you have it, however, it has a good indication that that's a good starting place for you to look. So antihistone. If I say antihistone, I want you to think drug-induced SLE. Now, what's the difference? SLE over here is not caused by drugs. There are certain drugs that do cause SLE. That's kind of beyond the scope of this lecture, however. Anti-Centromere antibodies. If I say anti-Centromere antibodies, what are you going to be thinking of? Well, this is I'm going to start this. This is also one of those kind of top 10, top 5. You should know this. Anti-Centromere. I've been tested on it multiple times in my lifetime. It's going to be limited scleroderma. Now, you're going to see crest syndrome. And stay tuned. I will make a video about crest syndrome, so I'm not going to get into it now. However, anti-centromere, think limited scleroderma, think crest syndrome. Now, anti-DNA topoisomerase 1. This is also going to be known as anti-SCL70. Maybe that SCL may help you. If you see anti-SCL, or also known as anti-double-stranded or anti-DNA topoisomerase 1, I want you to be thinking diffuse scleroderma. So that antibody kind of has a hint to as what disease, anti-SCL scleroderma. So diffuse scleroderma. Anti-mitochondrial antibodies. This is another big one. This is going to be primary biliary cirrhosis. Primary biliary cirrhosis. We got to keep moving. There's a lot of these to remember. So it is a lot of memorization. Watch this video again if it helps. Otherwise, this is just going to be a good starting block for you to start memorizing these. So anti-basement membrane. Now, anti-basement membrane is hit a lot upon, at least in medical school. So anti-basement membrane, hopefully you know this by now. It's going to be good pastures. If you see a linear anti-basement membrane fluorescence, especially of the kidney, I want you to be thinking good pasture. Anti-desmoglein. The desmoglein should clue you in. What disease has desmoglein associated with it? Well, it's going to be pemphigus vulgaris. I shorthand it PV, just pemphigus vulgaris. Contrast that to bullous pemphigoid. Pemphigus vulgaris is going to be kind of the flaccid or the non-tense blisters. Anti-smooth muscle antibody. What are we going to be talking about there? Well, we're going to be talking about autoimmune hepatitis. Not viral hepatitis, not alcohol hepatitis, autoimmune hepatitis. Anti-smooth muscle antibody. Anti-glutamate decarboxylase. This one's going to be more associated with your type 1 diabetes. So type 1 diabetes, you may see anti-glutamate decarboxylase antibodies. Not always, and if you do see these, it doesn't always mean you have type 1 diabetes. However, that's a good place to start looking. Anti-gliadin. Where have you seen this word before? Hopefully you're thinking celiac. Celiac disease. So affecting your intestines. Anti-endomesial. Also celiac. There are two antibodies. Remember SLE had multiple kind of key indicative antibodies? Same here. Anti-gliadin. Anti-endomesial. Alright, so celiac. Antimicrosomal. This is going to be another good one. Also, instead of antimicrosomal, you may also see antithyroglobulin. So these are also linked together. I'm trying to lump everything kind of together. Antimicrosomal, antithyroglobulin. When you see this, I want you to think Hashimoto's. Hashimoto's thyroiditis. This is, I would probably star this one, the thyroglobulin. It's affecting your thyroid gland. That's what Hashimoto's is. Hashimoto's thyroiditis. Anti-tRNA synthetase. Anti-tRNA synthetase. I'll give you a second, kind of like I have been. What do you think anti-tRNA synthetase is? Maybe I'll give you a hint. If I said anti-Jo, or anti-Jo1, same thing. Anti-Jo, does that ring a bell? Because these are the same thing. So if I say anti-Jo1, think also anti-tRNA synthetase. Give up. Polymyositis, or it could be, gonna run out of room. Situs. Polymyositis, dermatomyositis. So when you see anti-Jo, this is probably going to be the one that you're going to see more often. However, if they're out to trick you, they're going to give you this one. So this is probably the one that I would commit to memory. However, also realize that it's the same thing as this. So polymyositis, dermatomyositis. Anti-PM1, let's kind of use some logic. We just talked about polymyositis. Anti-PM1, so think polymyositis. Excellent. That was easy. Now let's move on. Anti-RO, anti-LA. So if you see anti-RO, anti-LA, now not to be confused with Joe, now we're talking about anti-RO. These are going to be lumped together, if that helps. What is it? Sjogren's syndrome. So the dry eyes, dry mouth, the dry picture, pretty much. These two together, these are also known as anti-ribonucleoproteins. Alright, gotta keep moving on. Anti-U1 ribonucleoprotein, or also known as anti-U1 RNP. So this is going to be mixed connective tissue disease. And then lastly, this is top 3. Whenever you see C-ANCA, there's one disease that you just it's gotta pop into your mind. Wegener's. C-ANCA, think Wegener's. So, this is all I'm gonna do on this video. It's just simply a buzzword and its associated disease. And that buzzword happens to just be antibodies. You're gonna have a whole list of these antibodies that you need to commit to memory. Again, I starred the ones that I would say would be most important. However, on any test, depends on who your teacher is, who's writing those test questions, they may trip you up. Certain antibodies have multiple names. So if you see an antibody, you also need to think maybe another name. Also, if they're anti-Smith negative, so if they don't express anti-Smith antibodies, you can't rule out SLE yet. They still could have SLE. You can't just look and say, oh, they have no anti-Smith antibodies. They can't have SLE. No, they could. It's because these antibodies aren't 100% sensitive and not 100% specific. They also may cross-reference diseases. So you may see multiple diseases. Here, if you see anti-Jo1, it really could be polymyositis or dermatomyositis. You really can't 100% differentiate. So, this is going to be one of those things in life where not the most fun. You just have to memorize this stuff. And the more times you are exposed to it, the more clinical experience you have with these, the easier it is to kind of get ingrained in your mind. But right now, it's just at that phase where you kind of got to learn it. So hopefully you found this video useful. If you have any questions, be sure to ask. I always love comments. And please click like. Thank you very much.